And perfect. I will hand it over to Amy at this time to go ahead and get started.
Awesome. Thank you, Stephanie and Val. I appreciate you all so much for organizing this. I think I'm going to share this the right way. We'll see. Okay.
Looks good.
All right, cool. So, yeah, this is exciting for me, doing a part 2 because quite a few reasons. I get to go into a little bit more depth on some examples. And also I'm hoping we can engage a little more and maybe be a little vulnerable and share what we're thinking in the chat. I have some prompts, or come off mute if we have enough time. But also too, just giving that space, I think, to reflect on a lot of this, I think is the most important, from part 1 to part 2, really being able to kind of let it sink in and have that thought through a lot more than just jumping right into this part. So I really like the pause that we took and being able to do part 1 and part 2, but happy to be here. Thanks for having me. I know some of this stuff is going to be a little bit repetitive, but I just want to introduce myself. I'm Amy Stiffarm. I'm enrolled Ani from the Fort Belknap Indian community. I also descend from the Chippewa Cree and Blackfeet tribes here in Montana. I recently got my PhD in Indigenous health, and the information that I'm sharing with you was part of my dissertation work because I focused on perinatal mental health during that. I also have lived experience. I had postpartum depression and anxiety, and kind of now knowing what I know, I definitely had depression during my pregnancy. So that's really been the motivation of getting into this work, looking at the research once I started my PhD program and seeing that there wasn't a lot out there and there wasn't a lot of focus for Indigenous people, other than it kind of being understood that rates of mental health issues in the perinatal period were higher among Indigenous women and birthing people, and that's kind of like as far as it was going at that point. So I did a deep dive, and this picture here on the bottom with a group of incredible women, some birth workers, some researchers, advocates, really looking at Indigenous birth equity in the United States, and just being a part of that and having mentorship and whatnot. So all that to say that this is really intentional for me. I've spent quite a few years on learning about this, and not just from textbooks, but from people doing the work. So with that, I'll just continue and give a quick acknowledgement. I'm coming in from Helena, and this land is indigenous to the Salish and Blackfeet people. We were kind of in the middle, so common hunting ground too in this area. So I love living here. It's a lot closer to where I'm from on the Fort Belknap reservation. A lot of this work that I did for my dissertation was done while I was living as a guest on the Flathead Indian Reservation. So I always kind of want to acknowledge that too. The other exciting piece since the last time I presented is that we have the website for the Native American initiatives at Healthy Mothers, Healthy Babies is live. So you can scan this. I don't know. You could take a screenshot or use your phone, and if you're quick about it, I am not, to take a picture of this. And then from here, you could actually download the version that we have right now of the toolkit. And then you can have more resources and more information about all the stuff in part 1 and what we'll be presenting in part 2. So this is a slide from last time, and it's basically what this series is covering. So we've already talked about some of this, and this time I want to talk a little bit about data and research. I'll try not to make it too boring, but I do want to give a little bit of background on that. And then talking about strengths again, but really looking at building collaborative relationships and some skill building, and going through some examples on what cultural safety can look like, and what some examples of some pretty common differences. And then I have some slides about some systems level work. And I do want, like I said, I have some discussion questions that I'll prompt you all with. So just for some more background, just to kind of center us on what cultural safety is, it's having that awareness of power relationships and addressing them by implementing reflective practice and by allowing the patient to determine whether a clinical encounter is safe. So again, this kind of is becoming more accepted in the United States, which is really great, because when I first learned about it a few years ago in the PhD program in Dr. Nicole Redvers' class, all the papers and whatnot that we read about were in Canada and New Zealand and Australia. So I've been hearing it more used in the United States, and that's really exciting. It's helping kind of raise that awareness of like that cultural competence is something, but it's not enough, and that we really need to be more, I guess, action oriented in this work, and really thinking about those power dynamics and how important those are when we're thinking about providing care, providing health care, especially to Indigenous birthing people and women. So a reminder, here are the 3 steps to cultural safety. That first part, what we went over last time, was really building that consciousness, learning about the historical impacts and some of the other cultural constructs that come into play when we're talking about the perinatal period and accessing care. This time we're going to go into some of that cultural appraisal, looking at those differences, and then I'll end with looking at some of the communication differences, not barriers, but differences. And then we'll have some discussion throughout and towards the end too. So just another reminder of the first step, and really focusing on learning about the people that you serve and how they identify, learning about the history and the cultural constructs. That's my dog, in case you can hear. I don't know if you can or not. Sometimes he's pretty good at blocking it out. And really reflecting on those personal beliefs with those questions that I left us with at the end. So one thing that I always preface this with is that we walked through some hard truth, and that's just how it is to get to health equity. And we did that last time together, and that's something that we will continue to do to reach cultural safety in Montana. So this is just some of the stuff that we covered. We talked about federal Indian policies and how that really relates still and impacts still Indigenous families during the perinatal period. So we talked about colonization and the start of MMIW epidemic. We talked about land loss and the reservation period and removal. We also talked about boarding schools and relocation. And one thing I wanted to share, I took this picture when I was home in Fort Belknap a couple weeks ago, a month ago, for a really good example. I've been meaning to take a picture of this for a while, and I finally did it, of just a cultural construct when we're thinking of really even prenatal care or giving birth. So these are signs that we have in Fort Belknap where they use the 2 languages. So there's Aani and there's Nakota, and they're kind of translating So this picture behind the sign, that's of our Indian Health Service clinic on the agency. And if you can see when Indigenous language, when our people first thought of hospitals, how they translate that to. So for Aani, that's where they doctor, meaning like where someone who is sick or needs help goes to receive care basically, or to get fixed up. Um, and then for Nakota though, that's sick person's house. And so I think that for me is a really good example of how things are just different. Um, with an Indigenous worldview. So from an Indigenous perspective, not you go a sick person's house isn't necessarily where you would send somebody who's pregnant or send somebody to have a baby. And I think that's just something to really think about when we're trying to make either our clinics, our workspaces, um, more accessible, more welcoming for Indigenous families, realizing that this, like, the root words for hospital come from these parts of the language. These are the questions that we ended with, and I just think it's really, for me anyways, like really powerful to think about, what have we been taught about Indigenous peoples? Where did we learn that information from? And what opportunities have we had to really learn? I still come across people, and it's understandable to feel like guilty for not knowing some of the stuff we talked about with the historical context and all of that. But it's always, I try to really remind people that I didn't learn this stuff until I went to a tribal college. Like, this isn't necessarily being widely taught. It's getting better, especially with the Office of Public Instruction's Indian Education for All, and other work that's happening in the United States, especially with boarding schools and whatnot. Um, it's more accessible, I guess, but it's still not being widely taught. So I guess all that to say, it's okay that you didn't know about this stuff. You know, this isn't about making people feel guilty. It's just about um, providing a space, an opportunity to learn, a place to start. I think about some of the work from my colleague, Dr. Mona Zufante, down working with the Winnebago tribe of Nebraska. Some of her work was on youth mental health and suicide prevention. And she interviewed the youth, and in their community, they were like, we want to learn about this stuff at a younger age. Like, it doesn't feel fair that we don't learn about this until we're older. Like, a lot of things make more sense for us when we talk about this. So it's not that it's just not something that non-Indigenous people are learning about. Indigenous people, Indigenous families aren't having these conversations either. And a lot of it is because it's hard. People didn't talk about their boarding school experience with their family members. People aren't talking about regularly, like, why the language isn't spoken as much. You know, these are hard concepts. And so it's not just non-Indigenous people that need to have these conversations still. So getting into this a little bit more with step 2, I'm really going to talk a lot about really this relationship approach in trying to identify cultural strengths. It's not something like, as a non-native organization, like, you're not going to determine cultural strengths within a community that isn't yours. So really talking about developing those collaborative relationships with Indigenous partners. So we're going to go into quite a few examples on that. And it starts with looking at differences in values as a potential strength and not just a barrier. At the very least, just a different, but not a barrier. Like that's the goal of today, that we kind of can let go of this idea that if it's different, if it's something we're unfamiliar with, then it's bad or wrong. I just want to give a little bit of background on data and research. I mostly just include this slide so people have this information because it kind of talks about a lot of things that we might be hearing of: Indigenous data sovereignty, data governance, all of that. When I talk about this, I like to remind people that Indigenous people have always been researchers. It's been different forms have been practiced in Indigenous cultures since forever. In the plains, there's a practice that was utilized called a winter count, where people would gather and talk about the things that happened throughout the year. So we kind of point to that as like a early form of evaluation work. But really it comes down to that Eurocentric thinking and that lack of valuing Indigenous knowledge and Indigenous ways of knowing, to where we weren't taught about that stuff either. In fact, there were plenty of attempts to actually destroy Indigenous data and knowledge. So it's important to recognize that colonization has impacted that as well. One thing that Abigail Echo Hawk talks a lot about especially like MMIW, when that was first coming about, missing and murdered Indigenous women, that epidemic, she talked a lot about data genocide. And that's really relevant when we're talking about maternal health for Indigenous people. It's that continued erasure of Indigenous people through the elimination or lack of inclusion of Indigenous people in data collection and reporting. So that can come from othering, lumping Indigenous people into this other category, or like CNN did a while ago, like something else. So that's important to think about, like when we're like, we want to know what's happening. We want to know if things are getting worse, if things are getting better. We want to know how things are right now. We want to know how many Indigenous people in our communities are dealing with something like postpartum depression, but we don't have those data capabilities yet. Shout out to the moms team, because they've done a lot of work at improving data collection, things like misclassification and whatnot in Montana, so that that information will be. And also just to highlight that really the current research does still tend to focus on disparities. That was one of the hardest things for me, and what really made me mad when first trying to study perinatal mental health, was like this huge focus on substance use. And in kind of a gross way of like, it wasn't really in a solution-oriented solution-oriented like narrative. It was really kind of in like a blame way, and in like a just really grossly focusing, as far as like doing a simple search on Google for, postpartum depression or perinatal mental health, and having tons, like way more articles about rates of substance use. So that kind of real focus on disparities. But even with that information, it's still very limited. And then there's a big lack of Indigenous perspectives, Indigenous authors, Indigenous people publishing this kind of information. So that's something to think about when we're reading papers and when we're looking at what the statistics are, really thinking of like, what is this narrative that they're saying? Who is this person? How did they include the community? Was it community led? And even further, where were the methodologies that were used? Were they appropriate? Like, were they culturally relevant? Was it something that the tribe had ownership in? So all this to say that when we're talking about research and program development and all of that, that the specific needs and solutions are going to come from Indigenous birthing people, Indigenous communities themselves. So it's really important to engage in partnership on research projects, program development, all of that. So when we're thinking of, it's important for data and research, but it's also important for program development. And I'll have an example of that a little bit later. I'm going to check the chat real quick. Okay, just introductions that I see. So to talk more about developing collaborative relationships, really thinking about how we're going to learn about these cultural strengths. And we've talked about it in the first part, and I'll go over a few more slides here coming up. But it's like, how are we going to learn that? How can we learn that? And it's by engaging the community. So really recognizing, like, if I'm not within a community, I'm not from a community, then I really can't on my own, not in a like way that has quality, learn about that without help from the community. And even finding ways to learn from birth givers themselves, like what do they need? What do they think would be helpful? And that's really good. That's really helpful in this field, especially maternal mental health, perinatal mental health, maternal health. We really do focus on lived experience, especially here in Montana. People are really always trying to find ways to get that that piece of information and that representation. So that's good. It's the same for Indigenous people. And it really comes down to building trust, right? Because all of the historical issues that had happened, and how we're really in a phase of rebuilding that trust still. So thinking about that it's going to take some effort, and it's going to take maybe a few meetings that you don't even get to talk about what you want to talk about, but you're just getting to know people and helping them get to know you. So again, really thinking about how harmful those deficit-based narratives can be, and how they perpetuate stereotypes. So, if you're always reading about a group of people and it's always negative, you're always hearing about those negative things, eventually we're gonna it's easy to start assuming that, being Native makes you sick, or all of those things that we know aren't true. Um, so really trying to focus on strengths, like something has enabled us to survive all of those things, all of those historical impacts. And what that is culture. So there's strengths there. And now more than ever, people are looking to those for all kinds of health things. It's not just maternal health, but it can be really helpful for maternal health. And it's really exciting to see that happen. So kind of going back to the impacts of negative stereotypes and deficit-based research, instead of really placing blame on communities with the work that we're doing, if we can hold space for them to tell us what's already working, or tell us, share some of the strength that they're seeing in their communities, then it's likely that those have been overlooked by Western research, just for how the education system and research has been done in the past. But all that to say, like, it has been changing. So this is a slide from last time. Again, just to remind people that culture has been proven to be a protective factor against mental health issues. There's lots of great research about that. And that's exciting to read about, because we were talking about this at work, and it's like something can be both. Like something can be like culturally informed and evidence-based. I am very cautious when I say evidence-based, because like something in the Indigenous health field that we say is like, whose evidence? Like, whose evidence is this? But this is something that's proven. Like, this is something you can use in grant applications or whatnot. Like, this is shown and researched. And then again, some places to look to start are this cultural strength, or culture card, the cultural strength section of the culture card that SAMHSA had developed. And when we're thinking of the perinatal period, when we're thinking of cultural strengths, some things that are really important are that this time period of like pregnancy and birth and parenting really viewed as sacred. So it's an ideal time. It's an ideal time for interventions, for people to want to do better or maybe change their life in some way, be a little bit healthier, get medical care, even like at the very, the very least, but also like a time, I think of it too as a time to really looking for culture. That's what I did. That's how I felt like when I became pregnant. I was like, oh man, like there's so much I don't know. There's so much I need to learn. So both from like the Western side and the Indigenous side, like this is a great time period to help like think about accessing healthcare, but accessing like cultural resources too. There's also that social relationship where there's extended family. You might see this in birth, where lots of family members show up for that person. Hopefully, not always now with like work commitments and other things, remoteness, rurality, where people can show up and continue that in the postpartum period. Like that would be the goal. There's also that intergenerational knowledge and wisdom. So having time with elders and really thinking of that having elders present and how important that could be to that birthing person, and making sure that um you know if an elder accompanies someone to their WIC appointment, that they're included as far as the birthing person or the woman the family wants them to be, and that they're respected there. And so, yeah, the retention as well as reclaiming traditional languages, cultural practices, and healing modalities. So I got to participate when my daughter was really young, and she went to the language immersion Head Start at St. Ignatius, was for the Salish language. I'm not Salish, but they wanted us all the parents to take Salish language classes. And that was, when I look back, that was right after I had my baby. So I have my second baby. So I had, postpartum depression. And what I realized is I was like, kind of in a way, like living for those Friday meetings, because I got to show up, I got to bring my baby, and there were people, like so many other women there that were like, oh, let me hold your baby. Like I didn't even have to worry about my kids at all during that time, because there was so many other women there that were like taking care of me. We had a good nutritious meal together, and we were talking about cultural things related to parenting and learning language together. And I look back at that and think, wow, like I didn't realize like how healing that was for me, and how important and impactful that was. So when we're thinking of like these programs and what kind of offerings we could work with tribal partners, Indigenous partners, to have, really thinking about how that relates to Indigenous cultural strengths. This is a image that I used in my dissertation to show about utilizing a two-eyed seeing approach in maternal or perinatal mental health. And this was coined by a Mac elder, Albert Marshall, and it's used to show how the different worldviews of this Western worldview, but also traditional knowledge and traditional practices of Indigenous people, how we could utilize both so that someone can receive like the best care. It's not a competition. It doesn't have to be Western medicine versus traditional medicine. It's about someone feeling comfortable to share like with their doctor that, oh yeah, and I'm drinking this tea that my aunt harvested and that we used in pregnancy, and being able to have both of those. So when we're thinking of the Indigenous cultural strengths, that could be language programs, cultural preservation departments, all of that, but even like if we're thinking mental health, like therapists and all of that. And really it just is more well-rounded approach to helping people heal and maybe even prevent some of these issues that can happen. An example of how we did this at Healthy Mothers, Healthy Babies, this work started before I came on like officially as a program manager for Native American initiatives, but this work is what started it. And it was for the Linking Infants and Families to Supports resource guide. So this is kind of like a shameless plug. I hope that most people know about the LIFT's resource guide, especially if you have a program that is relevant to the perinatal population. And at the end, I'll have like a little tutorial of like how to check if your place is on there, how to add a new service. But really, it's just a statewide online resource guide to help parents and caregivers find resources, but also for like physicians. Like if you're from Fort Belknap and you're going to Havre and you have people there, they want to know, they probably don't know what all Fort Belknap has. And so ideally they could log into LIFTS and look at the resources for Fort Belknap and help make those connections and those referrals for families. So both for the actual families themselves and for those providing care. So what we did and what I was hired to do was to be really focused on working with tribal communities to get their resources listed on this website resource. It was supposed to be like kind of a year thing, and this was sponsored by moms. So I kind of went through each reservation, and it was COVID at the time, so I was just doing things from Facebook, Google search. I was trying not to be too buggy, but if I knew somebody from that community, I would call. Some of them had their own local resource guides, which was but when it came down to it, and knowing what I was learning in school at the time was like, this is not enough. Like, this is not engagement, and therefore it's not quality. I was like, you guys really need to go back to tribal communities and share what you found, and ask them what they think. Like, that's the very least you could do. I mean, it would be fine if you guys did that at this point, because it was COVID and people kind of understood that programs weren't playing out the way they were intended. Well, they were like, great, like, do you want to do that? So I ended up doing this work for another year, and moms approved that and understood the value of like really engaging tribal communities. And that really started this relationship building, trust building, helping share information about HMHB, but really giving people focused on maternal health in the tribal communities like time and space to like get together and talk about these things and be heard. So from that, we were able to include a category called it's actually called Native Cultural Connections. So that way, things like when they first gave me, we're first like using these templates, like this service categories. It was, therapists, pediatricians, like all of that. And when you're just looking at reservations from a Western standpoint, like, yes, we don't, a lot of us don't have those resources. A lot of communities don't have that, but that doesn't mean that there aren't strengths there. So by including a Native cultural connection category, we're able to highlight those strengths and make it usable and accessible for Indigenous families in those communities. We also were able to make the guide searchable by reservation. So like acknowledge that these are sovereign nations, they're different than a county, they're their own unique place. So that was really important work for me to do, even like being able to do that here in Montana. And then eventually it led to the Native American Initiatives program at HMHB to continue that work. So that's just an example of where we can take the strengths from Western point of view and Indigenous, and that way people can have options, have access to those. The other thing I want to talk about when we're thinking of strengths and in Indigenous communities is this resurgence or renaissance of Indigenous birth workers or Indigenous doulas. So just to give us a clear starting point definition of like what a doula is. I think it's more work is happening in the state, which is really exciting, and people are kind of now understanding what a doula is. But for a long time, people thought that like a doula was similar to a midwife. So, for definition's sake, doulas are really trained to provide that non-clinical support, so emotional, maybe physical, informational support. And, and this can occur, like if you're thinking full spectrum, it can really, prenatal period, during, not just during childbirth, but postpartum too. And then community-based doulas are people that are working, that are from the community, working within the community. And that really relates to an Indigenous doula, except for an Indigenous doula does all of that, but approaching their work in like rooted and grounded in Indigenous cultural values, and kind of approaching their work in a sacred way, or under having that worldview value that birth is sacred, pregnancy is sacred. So depending, doula is not a word that was utilized before. So there might be different words that people call themselves. Like for some people, this is just their role as an auntie or as a sister. But birth worker, there's a lot of different terms that maybe you may have heard. And also this goes to show that this is not something new for Indigenous communities. It's not, Indigenous doulas isn't something we're teaching tribal communities to do. We're helping them to remember that these are roles that have always been within Indigenous communities. And the significance for that, and we know there's plenty of research out there already on the like medical benefits of a doula. But I like to point out, especially to tribal communities, the cultural significance of Indigenous doulas, because they're really important to this cultural revitalization. For me, when I was pregnant, I realized that I didn't know a whole lot about pregnancy, about childbirth, when it like traditional aspects of that. I knew a whole lot about death. I knew how to plan a funeral. I knew, you know, that who to contact and what was going to happen, like what the spiritual leaders were going to do. And I knew all of that stuff, but I didn't know anything when it came to birth. And that's kind of was a big push for me to get into this work too, as when we're thinking of Indigenous doulas in the communities, and moms has brought in some funding and they were able to sponsor some Indigenous doula trainings in tribal communities. Those are like seeds being planted to me. Like that's how I think of it. It's like, yes, all this medical reasons for doulas and that support, but really thinking about getting excited about people being in these communities that never really thought about it before, about how can we reclaim this knowledge, or how can we start practicing these things again. This is something that has always been a part of our cultural values, and so really thinking about how we translate this knowledge and these values onto the next generation. And the other exciting thing is, like, we are doing some work in Montana to reimburse doulas through Medicaid. It hasn't happened yet, but tribes as sovereign nations are really uniquely positioned to offer these services in a different way, like maybe the Indian Health Service one day, but even tribal 638 programs. And for those who don't work as closely with tribes, might not know what that really means, but I always try to say it to like plant some more seeds of ideas. So are there thinking about some of these cultural strengths that I talked about the first time and this time, are there any Indigenous cultural strengths that maybe you've witnessed, or that you've seen or heard of in your practice, whether this be like for actual family providers, or maybe people working in WIC clinics, however. And I was telling Stephanie Fitch that this is a little bit of my nightmare of like making people talk to me on Zoom. Like I know it's a vulnerable place, and I know not everybody like wants to engage at that level, but if you would like humor me and like even put in the chat if there have been any Indigenous strengths or if you have any other questions from the presentation up to this point, I'm gonna keep an eye here on the chat and give people a little bit of time.
Amy, this is Mary Robertson. I was
Okay.
at Ani Nakota College a month or so ago and was lucky enough, blessed enough to be able to work a bit with people from the nursing program there. And one of the things that happened is we went to lunch in one of the buildings that offers lunch Monday through Thursday um, for the students and whoever is there. And they offered Juneberry soup.
Mm.
Not anything I'd ever had before, but the idea both that it was there for anyone and that it was something to introduce a cultural piece seemed delightful to me. Not the purpose of my visit, but I was thrilled to be able to participate.
Right. Thank you for sharing that, because even something as what sounds as simple as
Mhm.
sharing a meal together and offering traditional food, like yes, there is a lot of strength there. And even in the fact of like you're, it's there for kind of educational type visit, but then you got to experience some traditional food. And oh my God, when you said Juneberry soup, I just started salivating because my mom makes that for me for ceremony these last few years. And like, I just love Juneberry soup. So thank you for sharing that, Mary. Um,
The other thing I was aware of was the thoughtfulness of having food available for busy people who are studying or working or whatever. That
mhm.
that struck me. So thanks,
Yep.
Amy.
Yeah, and there is so much power in sharing a meal with people, and that's some other work that I've been a part of. Always important. I know it's tricky with like grants or different things, but if you can really find a way to share a meal together, it's really powerful, and it really shows a level of respect too. Um, Another one in the chat is Indigenous family members advocating for one another. Yes. And then multi-generational families residing together. Totally. That way having access to elders in your home, like that is really powerful, especially when it comes to parenting. Sometimes uh, I've heard of families where the parent didn't learn their Indigenous language because of either boarding school or their parents wouldn't teach it to them because they wanted them to not have to suffer the way they did in learning English and whatnot. But the grandparents taught the babies, and so it kind of sometimes skipped a generation. But those are some really cool stories that I've heard of. Okay, I'm gonna go on for the sake of time. So step 3, this is really when we're gonna start talking about these like differences, I guess, and really thinking about mostly communication and how we're interacting with Indigenous families. So one thing that is, I think, kind of commonly known is this when we're talking about like nonverbal communication is eye contact. Um, and it's really great. I've been reading since I've been done with my PhD program. I've been finding myself reading a lot more Indigenous literature, like fiction type stuff. And it's been cool because some of these things that I talk about or that are in the toolkit or that I give examples about, they're right there. Like they talk about them. These Indigenous authors mention them too, and this eye contact thing is pretty common in a lot of different tribes. But we're just kind of taught like not to look somebody in the eye because it can be seen as aggressive or disrespectful, and so a lot of times people will just look at the ground or not look at somebody in the eye when they're talking. And in Western society, that can be seen as like they're not paying attention or that they're being rude or dismissive, but it's not really the case. In fact, it's the opposite. It's rude. For some Indigenous families, it's rude to like look at somebody right in the eye. So this can actually be seen as showing somebody respect, or at the very least being non-confrontational. So just even like when we're in an appointment with somebody who's Indigenous, not taking it the wrong way if somebody's not making eye contact. This is a picture of my daughter Tamaya when she was younger. She had sensory processing issues. So I was taking her to OT, occupational therapy. And one of the occupational therapists that we had first seen was like, well, she doesn't make eye contact. And like, kind of like in this way of like, how could you not notice that your daughter doesn't make eye contact? It's like, well, I didn't know, or I never really thought about it. Like, that's not something I think of. And she's like, what do you mean not something you think of? How can you not tell that your daughter doesn't make eye contact? It's like, well, we don't really make eye contact anywhere. Like, I'm not like, we don't encourage that. We don't, and like, it really caught me like as a parent of like, I felt really bad. Like, oh my God, could I have like caught something sooner in my daughter, or I don't know, but it was also just kind of the way that this OT was like making me feel stupid, whether that was her intention or not, for not knowing that. And she didn't realize that that was just a difference in cultural values. So that's just an example that I like to use and think about when I'm thinking about eye contact. There's also this thing that it's like deep listening, but there's this use of silence. And this is true, especially with a lot of elders. And it's using this period of silence when someone's communicating with you. And so it kind of comes across as like these long pauses of silence before somebody responds. And in Indigenous cultures, like, words are super important. Like, words have power and have meaning. And so people are taught to like be very careful with what you say and what you speak out into the world or into the universe. And so sometimes people are really raised to, or just it's part of what they're taught is to really think before you talk. And, in a way, we're all kind of taught that, but from an Indigenous perspective, it's something that is pretty common, where you really take the time to respond. So if someone doesn't get back to you right away, give people time to reflect more, and try not to like fill the space with maybe the awkward silence with things, just or not be offended if someone doesn't respond right away. It could be that they're just really being reflective and trying to process, especially if it's about a serious health concern or something. So yeah, it's just a time of deep listening and taking the time to understand what's being said, and giving them adequate time to respond accordingly. Another difference that I like to talk about is this differences in perception of time. So from an Indigenous perspective, time is seen as cyclical rather than linear. And that's kind of also is shown in the way if you've ever heard about like 7 generations, or when Indigenous people, especially the elders, talk, they pay respects to their ancestors, and then they mention thinking, about the 7 generations ahead, or about the next generation. This is because of that, it's not necessarily like a linear time. It's like it's cyclical. And so sometimes there's jokes about Indian time being like just an excuse to be late, but really it's this idea, this belief, this worldview that things happen when they happen, and that if someone is late for something, it's just because something more important was happening, or it wasn't the right time. And you see this a lot at ceremony, when you can never really say, oh, it's going to start right at 3 o'clock. That it just doesn't work that way. So all that to say, like, don't take it personally when people are late. In fact, like, go a step further and find ways to incorporate allow more time or find a way for people to be seen even if they come, because like talking about all those impacts and the trust building and all the things that people have to go to just to get to like a prenatal appointment or whatnot, try to be more flexible. I've heard of some tribal health areas, the same one, Winnebago, implementing policies so that people are seen no matter if they're 15 minutes, a half hour late. But there's also different ways, like even having like group prenatal appointments, or for it's all afternoon where people can come and get care when it's right for them. Just some systematic considerations, really, and these are just going to be in the slides for you all to kind of go and look at further. But how can we hold our organizations and systems accountable, to changing these policies and making sure that our policies are culturally safe? What are some things that we can do systematically so it's not just one person learning about cultural safety in your organization, which is helpful, but when we're thinking about making systematic change. The First Nations Health Authority in Canada has a great list of like several recommendations around this area. So looking at ways to increase provider education, evaluating and measuring cultural safety across the organization, increasing the Indigenous workforce, and then creating physical environments that are culturally safe. So, and I have this next slide is some more concrete examples. So some ideas for cultural safety, thinking of that first step of learning more about who you're serving, is like take a class at a tribal college if you can. A lot of them have online spaces now too. Tribal colleges are great for partnering with, as Mary was talking about, and visiting Aani Nakota College. We were just there in October, I think, for an Indigenous doula training. So they're really a great resource when we're thinking of partnering. If you can't do that, like maybe start a book club where you read work from Indigenous authors, because even if it's fiction, there are lessons in there, and there is information that'll help you better understand Indigenous communities. Some other fun examples that we've heard of and dreamed up a little are like hiring Indigenous people who are local to like make baby moccasin kits, or to host moccasin making classes at your organization. Just make sure they're local, or else you might make people mad. But doing things like that. Maybe you want to put up a star quilt or give out star quilts to the Indigenous babies born in your clinic, like hiring someone local to do that. Those are just some ideas to just make the space more comfortable. Make sure all your staff are aware of policies. So things like smudging, if your organization has a smudging policy, make sure that your staff is aware of that and that they've practiced talking to Indigenous families about that smudging policy. Like maybe they're allowed to, and they just have to have someone come in and turn off the oxygen, or however that works. But or maybe there's not in that specific wing of the hospital, but there's a room here. Same with the waiting room. If the delivery waiting room is small and not good for big, huge Indigenous families, don't say like, oh, you're only allowed two here. Find a place where they can go and be comfortable. And then participate in local events. So we were talking, and some people were saying that like the powwow in Missoula by University Montana, Kiayo, non-native people weren't sure that they could go. And so I'm going to start making it a point now when I have ears to let people know, like if it's advertised and you see a poster or a flyer about it, then you're welcome. Like if they didn't want people there, they wouldn't post it. So there are places like, yeah, like you might not have access to, our communities or families might keep private, but you won't hear about those. So if you see a poster, it means a lot, as someone who grew up on a reservation, seeing a doctor at IHS or seeing your teacher come to your powwow or your local events, like means something. So that's a good way to to get started. And then take an active role in partnering with the community. So start making phone calls, and it's not about just like what you want, like, oh, I have this grant and we need this deliverable, but what do they need? What are they working on? How can you partner? Do you need to make sure that the referral system is efficient? What can you work on together? Part of this work we did was an engagement day on the Blackfeet Reservation. And we hosted that, we organized it, it's with labor and delivery nurses. We'll be doing more work on that. But all that to say, it doesn't have to just be us doing that work. Like, and when I say engagement day, it's really about how can you work with a tribal program or group to come to the reservation and share a meal, maybe just the first time, like Mary was talking about, or have a meeting on the reservation, come to the community and visit the departments that you're referring to or that you want to grow a relationship with. So again, like, it's not just enough to learn about Indigenous culture. We really have to approach looking at the power dynamics. And when we do that, we're going to have to approach this working with in like relationship and building trust with Indigenous peoples and tribal nations. And these slides, if you want to take some screenshots there, if you've joined with a person or other people on these webinars, these are some really good debrief questions that you can work through either on your own or with somebody in your organization or whatnot. So I have 2 slides here. Let you guys take a screenshot if you want. And then the other one, I'm sorry, I didn't leave very much time for questions. I'll check the chat real quick if Stephanie will give us a little bit more time.
Go for it.
Awesome. Cool. I see some really good stuff in the chat. Awesome. And I also, while people think of questions that they might have or put them in the chat, I just wanted to show you that on our lifts at hmhb.org, if you're on the lifts website, there's a place when you scroll down where you can submit a service or leave feedback. And when you leave feedback or do anything, Dawn Gunderson will be able, she's the nicest person in the world, and a lot of you might know her if you utilize our Essentials program. She'll be able to reach out to you, and if you submit a service and you're afraid you do it wrong, she'll get to you and figure out what information you want to put. So this is just make sure that your program or your information is within the LIFTS resource guide, because it's really helpful. Yeah, so that is all I have. Thank you all. Thank you all for joining parts 1 and 2. That's awesome. And I hope you all are able to debrief with people on some of the stuff that we learned.
Awesome. Thank you so much, Amy. That was great. And thank you everyone for joining. If you do have questions, we will send out the evaluation link as well as the slides, and that has Amy's contact information. So if anything comes up later, you'll definitely have access to her.